first time to actually get to meet in person, and even though we've had some challenging and wonderful conversations over the phone. Well, while we're finishing getting set up, I thought I would tell you a story that relates to families. I was raised actually just about 30 miles south of here. So this is my home state, and I was raised in a good Baptist tradition. And on the fifth Sundays when we had Sunday evening service, we had Sunday song service on fifth Sundays. And my aunt told me one time about that there was this small community church, and the pastor got up and he said, "We're going to do something different tonight for song service." He says, "I'm going to give you a topic and you tell me a song to sing." So he said, "Okay, our first topic is love," and they said, "Love is the theme." So they all sang "Love is the theme." And he said, "Now the next topic is heaven." And so they sang "When we all get to heaven." He said, "The next topic is grace." And so they all sang "Amazing Grace." And he said, "The next topic is sex." And everybody got really quiet. But Widow Green over here, about the second row back, she raised her hand and she said, "Precious memories." And one of the things that I think we're missing these days, and you know who I heard that from? My aunt. She was like 85 years old when she told me. She really, and she just laughed till she shook all over. It was wonderful. But I think the bottom line is that what we want our children and our grandchildren to have when they're 85 years old is some precious memories. And some of the things we're building right now, I think they're missing part of the beauty and the specialness and the possibility of really building a tradition of great love and great commitment. And our children certainly are having trouble with that now. So this is actually more of a data talk because, as I mentioned, I've done a lot of, or as Michelle mentioned, I've done public health and I've done some actual work in pediatrics, and I got to work in the government, which I was so glad to get out of. Washington, D.C., I had this conversation with Iris. Where did you go, Iris? We are really glad that we are from D.C., and not there anymore. So at any rate, though, I am still teaching with Texas A&M Health Science Center, but I'm mostly retired, and I have 12 grandchildren now. So I missed last evening with you because I had a birthday party for Sarah and Maddie. We combined two of them. All right, so what we're going to talk about today is looking at family structure, look at what some of the demographics are, and then look at the benefits of father from a demographic and public health perspective as much, really more than a biological one. And if you get into discussions, all right, I'm going to play like I've been on well, when you look at public health concerns, some of the things that we look at universally across our nation right now, we worry about things like education, nutrition, and mental health, substance abuse, violence, and everybody's struggling on how to fix all this stuff. And you're going to be addressing some of it as well in your practice as well as in policies. So if you're looking at that, one of the places that's got a really good piece of information, and I hope you'll look at closely, is the Adverse Childhood Experiences Study. Actually, it started when they were trying to figure out why some obesity intervention programs worked and some didn't. But it was at Kaiser Permanente, it was funded by CDC, and they came up with some very interesting findings about how to predict whether interventions would work for people that had serious problems. And they did actually start looking at all that list that we saw a while ago, violence, substance abuse, mental health, and so forth. And these are some of the things that they found. They had 10 reference categories that had abuse, household dysfunction, and neglect. And primarily, and I thought I fixed the font on here, but I didn't, apparently. But the household dysfunction is really going to be where we are focusing today. People that had a mother that was treated violently, or a household member that was alcohol or a drug user, or someone that was in prison, or number 5, not raised by both biological parents, these people had increased health problems. And I couldn't get a really pretty view of this pyramid. Jane, you may know how to do this better than I do. But basically, they showed that if you have increased problems in your childhood, there's social, emotional, and cognitive impairment. And I think all of us can kind of relate to that, even from the brain discussion that Jane did yesterday. And that leads to an adoption of high-risk behaviors that lead to disability and disease, social problems, and then finally to death. And we are finding that people that have more difficulty with their family just never are as healthy. And let's look at some of the pieces that would lead to. When I teach medical students, a lot of times I'll say, okay, let's say we want somebody to adopt a better health behavior. How are you going to change a health behavior in someone? And almost invariably, they start off with, we need to educate them about the problems. And so we often talk about, well, we're just going to change a health behavior by changing what people know. But we have to really recognize the associations between childhood outcomes and the need for a stable family. And we need to be able to recognize that just telling somebody not to eat Oreos for their afternoon snack every time, that may not do it, just telling them that. So there are other things we need to be aware of. How do we actually reverse problems with health? Now, for a long time, we've gone through the preventive health approaches, and this would be a standard one. So we were just going to do a drug intervention to prevent drug abuse. But if you look at that, just a year ago, just almost 2 years ago, there was a statement that came out that said the evidence about primary care-based interventions to prevent or reduce illicit drug use in children and adolescents is insufficient, and the balance of benefits and harms cannot be determined. What does that mean? That means we've been told for 30 years to talk about drug use in the clinical setting, but they can't prove that it helps or hurts. We don't have any proof that that's helping on that. So what do we do? What does help? If you start looking at the ad health data, we know that parent-family connectedness and perceived school connectedness were protected against every health risk behavior. So a clinic intervention doesn't help, but a family connection helps. And then just about 3 years ago, 3 years ago, there was notably family structure and parental closeness were important protective factors against drug abuse. So even if we only use drug abuse, it's not some fancy little pamphlet that's going to make a difference. It's the family that makes a difference. And part of that is because if we really want to improve health, a lot of times we automatically think, well, we just need to improve the knowledge. How much of a change do you think you make with your patients by just giving them a piece of information? Like, don't eat French fries. How many people really quit eating? All right, so knowledge, we're all agreeing, and probably it changes in the single digits. Maybe 2 to 5% of people will change just based on knowledge. So if that doesn't help, what do we do next?
Scare them.
Scare them. That's right. It's called motivation. Michelle has it. She's used it before, I'll bet. And actually, well, we have two kinds of motivation. We have the positive motivation and the negative motivation. And so a lot of us will use that with our children, obviously, and also with our patients, where we say, I'm really worried about your hemoglobin A1C. Let's see what we can do about that, because you might have this problem, and so we motivate. But then how many people actually change based on that? There's a few more, but not a lot. So what do we do next? What's our next step? We have to teach them some skills. We have to say, this is how you eat. This is what you do. That kind of thing. Okay? And so that helps a little bit more. But when I was up in D.C. and I was working in HHS, they had a secretary's visit where we had a report from CDC on the efficacy of condom programs. These were with HIV positive patients that they were trying to get to use condoms. And CDC came in and they said, well, we've got a clinic We teach them, we provide condoms, we show them how to use them, and so the secretary was like, well, what are your results? And they said, well, we get an improvement in condom use of about 20% for about 3 months, and then they're back at baseline at 6 months. So what do we do if we know that knowledge, motivation, and skills can be short-term and minimal? Okay, I'll give you the example from my sister. My sister has a master's in education, and her son is a kinesiology major, okay? And that means he's a PE teacher, okay? And so, anyway, he came home from college, and he said, Mom, they've opened a new gym. I want you to go to the gym with me. And so the two of them got up, and she went all summer long. She went to the gym. She toned up, she trimmed down, she looked great, she felt wonderful, and he went back off to college. How often did my sister go to the gym after he went back to college? 0. Now, it wasn't because she didn't know it was good for her. It wasn't because she no longer wanted to be healthy. It wasn't because she forgot how to ride on a little bike in there or walk on a treadmill. The difference was what? Her support system was gone. And when we try to make a change in society, and we don't address the fact that it's actually, well, and this is not going to come up, it's not supporting me on my support system thing. Just won't go anywhere. Okay, let me try that. Anyway, so it's supposed to say support in there. Oh, you know what? This would be awful if I just had to talk to you all with this. Okay, but our support system is what really predicts what we're going to do. Please remember that when you are interacting with your patients, that the key to actually having something change is really whether you can connect with what's important to them. And now we have, I feel supported. Okay. All right, so the support system is, health education is important, motivation is helpful, skills provide some capacity, but support predicts action. So behavioral interventions do not predict health wellness. The relationships predict wellness because relationships predict sustained behavior. And so when you think about how you're going to interact with your families, with your pregnant women, remember that you have to always remember the only thing that's going to actually help them comply are the people and the values that are important to them. So if we're talking about relationships and health, then what we need to consider is that we have not been trained on helping fathers and mothers be involved with some of our patients. And the reason for that is that we got really, really smart about the time I got into college, because I'm a baby boomer. And we had some paradigms. And actually, Dr. Grossman alluded to some of them. One of them was marriage was old-fashioned and confining, and the open relations were healthier and more conducive to personal development. We had one that fathers were kind of nice, but they weren't really necessary. We had the assumption that it's better to live with a happy single mother than an unhappy married couple. And the other one that you referred to is kids are flexible, they'll be okay. And then we also believe that the financial disparities were the biggest problem. So yeah, a couple that has a father and mother both raising a child, the kids seem to be doing better, but it was just because they had more money available. That was the main difference. Okay, and our beliefs have changed the world. We have fewer people, marriage occurs later, and fewer people. We have fewer children. Single mothers give birth to a lot of our kids, and much fewer of our children live with both biological parents. These are just some comparisons. In 1960, we had a marriage rate at 22, and now it's 28 for males, and we're up to over 27 now for females. And the marriage rate is also half of what it used to be, and divorce still is very prevalent. It's remained at about half the rate of marriage. And here's the trend. Here are the trends, and there's some fascinating things that are happening. And I actually probably should have pulled out the newest one, but I'm so lousy at moving pictures into documents, and it's been looking about the same. You know that the rate of pregnancy for teenage girls has continued to go down, and also also the rate of 20 to 24-year-olds. But the older women are having pregnancies more, and we are seeing now in 2014, 1.6 million of our births were to single moms, and it's remained between 40 and 42% now for about 10 years. And we are seeing fewer non-marital births in the younger age groups. But this is what it's looking like for the percentage of children who actually live with their married parents and their first marriage. We're below half now. So what difference does that make? Because sometimes they're still with two married parents, but one of them is not their biological parent. Sometimes it's with a single parent, and sometimes they're not with a biological parent at all. So there's been the argument, in fact, some of our data collection for a long time, for instance, in child abuse, if a child was hurt by a man in the house, it was registered as being abused by the father, whether it was the new boyfriend, the stepfather, or the biological father. And we're finding that, so we just thought cohabitation's the same thing. But we're beginning to see, and one of the first articles that came out on this was actually sponsored by the NIH. And they looked at trust in cohabitating relationships, and it's much, much lower. But even though there's some difficulty with cohabitation, the fertility rate is still very high. One of the things that I think is fascinating is we now know that cohabitating men make about half, or less than half, of married men. Isn't that an interesting concept, that they would actually make a lot less, and that 7 in 10 children of cohabitating couples will experience parental separation. Usually that's before the age of 12, and the separation is 5 times higher. So marriage is really difficult, less stable, more stable than cohabitation. One of the frustrating things, and I had an opportunity to work on an American Academy of Pediatrics Task Force in a family about 15 years ago, and we looked at cohabitating families, even if the father was the biological father, and it's a fact that these children have less available resources to them. Because if a couple is not willing to make a commitment to each other, to share the efforts and the activities of parenting, then it's more likely that the dad's going to say, no, I'm not going to buy that new baseball glove. I've got someplace I want to go fishing this weekend. And it's more likely for the mom to also hold on to her money. There's just not a commingling that benefits the child. So the resources are spent more on adults and less on children in that environment. And of course, if the men are making an average of half as much, you also have diminished resources available to them. So we do have a lot of cohabitation disruption. You can see it's at least half by 5 years. How does this impact the health of the children? So if you don't have two committed parents, does that make a difference? 5 years ago in December, on a weekend, during Christmas, there was a report released from the CDC. And it's this one right up here. And it was just a small study. There was only 250,000 households and 630,000 people. And it was released without a press conference or without even a press release. It was released absolutely silently over Christmas on a weekend. Even the people that do research on children didn't see this for 4 to 6 months. Why in the world would something of this magnitude be released in the middle of a research desert? Basically, it's because a lot of the folks that released it didn't want to deal with the policy implications that happen as a result of this. So what did they find? First of all, this is just a screenshot from that particular document. I would encourage all of y'all to go get a hold of it. If we're talking about 2/3 of 1 million people, we need to know what this is saying about what's happening in our society. This is a decade old almost now, but you can see that the nuclear family, even then, is less than family is really the next biggest group that they live with. Cohabitating is a very small percentage, which I thought was smaller than I thought it would be. And I think that has to do with the fact that so many of the cohabitations dissolve within a few years, and this was looking at children through high school age. So one of the questions they asked was, is your child not in good and excellent health? And you'll see that the children who live with both married parents were twice as healthy as many of the other groups. So even by just general report, the children were more than twice as likely to be healthy than the children who live in different family structures. Being with their dad made a big difference societally. Some of the things were about the same, like hay fever and ear infections and some chronic conditions and asthma. Those were about the same, whether or not you were married, the parents were married and dad was living there or not. But some of them were really different. For instance, who would know that dads prevent headaches? And one of the other things is that mental retardation and developmental delay was half as frequent in nuclear families compared to others. And then the same thing was true for special education and behavioral problems. Now then, there are some things that were just like procedural differences. One of them was the use of the emergency room. People who are married go to the take their kids to the emergency room much less than other groups do. And I've seen pediatricians nodding here as well. To me, that makes a lot of sense. Because if I've got a vomiting child at midnight and I've already spent the last 4 hours taking care of them, and my husband walks in and says, honey, I'll take it from here, you go get some rest, you can keep going. If you're the only one in the house to take care of that child, you're going to be like, I've had it, load up, let's go. And so we'll see that there's a much better use of health facilities and services. So there's better use of routine long-haul services, better use of more consistent use of prescriptions, more frequent use of the medical home, or more appropriate use of dental and vision services. So a daddy, who would have thought daddies make a difference on these things? You know, we like to talk about the warm, fuzzy stuff, but as a society that's making policies, this tells us that we need to be supporting daddies who are married and in that home. All right, this is one of the most difficult ones, because the biggest differences in the whole document were on the behavioral, mental health, and educational perspective. And they seem really, really sensitive to family variation. But then there are people that would argue, oh, well, this is a kid that's got chronic disease or a chronic depression or a chronic problem, and it just broke up the family. And believe me, all of us have been there who've seen a very, very difficult developmentally challenged child where the family started fracturing because of all the stress and exhaustion. That does happen. I'm not going to downplay that. But we really have to find out, was it caused by this, or was it, did the behavior become worse because the family was not connected and mutually supported? So let's look at, if you look at ADHD, this is just one snapshot. 11% of boys living in nuclear families had a learning disability or ADHD, compared with 20% of boys in single-parent families, 21 in blended, 19 or 20 in cohabitated, 15 in extended, and 22 in other families. Really, really challenging and interesting data, and same thing is seen in learning disability. And then this was my favorite quote, and this is a snapshot out of it too. Children in nuclear families were generally less likely than children in the remaining family types to have a learning disability or ADHD, regardless of parents' education, income, poverty status, place of residence, or region. In other words, these kids were better because they were living with their biological mom and dad, and it wasn't because they were richer or they lived in the right area of the country. This is a very profound statement in terms of policy and the role of mothers and dads working together to care for these kids. And then they have lots of these charts here. This one's really profound. Look at the difference on severe emotional or behavioral problems. Look at the differential between the nuclear and the other family types. really, really remarkable. And this is for like 250,000 children. This is not a small sample size. And so basically, this documents that you have different outcomes, improved access to care, rates for special health care needs, academic achievement. On that. One of the first studies I ever saw, this was about 30 years ago, that had to do with fathers. It had been a longitudinal study on looking at what predicted kids going to college. And they had done all this little tracking on 2 or 3 high schools, and they tried to figure out whether it was band that meant that the kids went to college, or whether it was a tutoring program, or which things did the kids take that predicted them going to college. When they did the final analysis after the kids graduated, the single highest correlate was whether daddy attended PTA meetings. Fathers participated in PTA meetings was the strongest predictor of attending college. And I think it's really easy to extrapolate why that may be. Violence is also a big difference. Behavioral, child abuse, neglect, sexual exploitation of children and young teens, and that's something a lot of us care very deeply about. And then risk behaviors, of course. If you look at single versus 2-parent families, look at the time differential. So if you've got a 2-parent family, the mother spends about 40 minutes more per day with the child, and the dad spends over 45 minutes more. So children who have both parents around are incredibly richer in terms of the parental attention. The other thing that I think is really fascinating on this is when you have a single parent, especially when a child is born to a single mom, if they've lost half of their background, a lot of time by the time they even walk out of the hospital, they have 50% of the support system that somebody that has their biological parents caring for them. Okay, so the other good question that always comes up is, well, it's just because of the finances, and I alluded to that earlier. And there are some really distinct patterns that happen on finance for these kids. And it has to do with the commitment of funds to the child, the commitment of funds to the other child support obligations, and the stepchildren. So we know that the children who live with single-parent families are 5 times more likely to be in poverty. So there's some Nordic countries where they were determined to reduce the disparity between the incomes of a single mom and the incomes of a married couple. And so it's, I believe this is in Sweden. Sarah McClanahan, if you followed anything on child well-being, you may read from her. She's really covered this for 30 or 40 years now. And this is what she had looked at in Europe. Cohabitating parents were closer to single-parent families than married parent families in terms of economic disadvantage. Children living with their mother and cohabitating partner have the poorest outcomes. That's kind of an important thing for you to know. If you're dealing with a young mom that's tired and exhausted, and she just thinks, if I can just get married, things will settle down. You know, we need to be able to be honest about this. Yeah, I want you to be loved and I want you to be comforted, but you need to know that may create some new obstacles for you and your child. Cohabitating biological parents also provide lower quality parenting. The presence of half-siblings and step-siblings accounted for a great deal of poor outcomes. There's some very compelling and actually distressing literature that's come out of Canada too on the outcomes for children in step-parenting families. We need to be looking for ways to support the biological married families when we can, and also help these step-parenting families to recognize what the obstacles might be so that they can have more of a sense of equity toward them. And then, of course, in the very generous Nordic welfare states, children living with single moms have fewer material resources, less parental support, and poorer health than those. Okay. So relationship poverty is a stronger prediction of poor outcomes than resource poverty. I see Miriam nodding, so that makes me feel good. So, anyway, and parents are also healthier when they are when they're in a stable and committed relationship. And we know that fathers have lower rates of depression and better productivity. There's less domestic violence. We have fewer victims or perpetrators of crime. And also for those of us in pediatrics and OB-GYN, we have lower rates of prenatal, of infant risk and infant mortality. And we also have better rates of cancer recovery and cardiac recovery. So back to this pyramid, we know that if we can reduce the adverse childhood experiences, we can actually improve long-term health. And we need to be, all of us need to be spokesmen to people for that, and that particularly as it relates to stabilizing and encouraging strong homes. So now we know that the data is the strongest predictor of academic success. They are associated with fewer behavioral risks and improved mental health. And they also, of course, provide financial stability, and they teach some very important things like decision-making and so forth. And they're even important for adult children, because we know that the children who have lived with their dads do go to college and complete it, and actually they tend to have better relationships themselves when they get older, because they've seen the modeling. So, to sum it up, we used to say marriage is old-fashioned and confining, but now we know that it's beneficial. We used to say that open relationships were healthier, but now we know cohabitation is of low stress, of low trust, increased stress, and more prone to violence. And we used to say that fathers are nice, but they're not necessary, but dads have a real value to their children. We also said that it's better to be divorced than to live unhappy, but we know now how to help have good enough marriages that really allow for health and strength in the families that we can salvage. And we used to say that kids will be okay, they're flexible, and now we're finding out they're not nearly as flexible as we want to pretend they are. They're really pretty sensitive, they should be handled with care. And then the financial disparities were the reason for differences in achievement. How can you help? Acknowledge the shift, say what we believed and how much we've learned, so we're not going on last year's theories, but on today's realities in terms of data. And encourage high-impact opportunities through your church, your community, and your clinic. One of the things I want you to do routinely is to tell everybody to have meals together with the TV off, okay? That's one of the takeaways in terms of things. If you just look at bullying, the kids who have 0 meals with their parents per week are 7 times more likely to be involved in bullying, either perpetrating or victims, than the children who have 4 more meals together. And that's data that just came out a year ago in November. So, Eric Metaxas has written about Dietrich Bonhoeffer, and he said the rich world of his ancestors set the standards for Dietrich Bonhoeffer's own life. It gave him a certainty of judgment that cannot be acquired in a single generation. He grew up in a family that believed the essence of learning lay not in a formal education, but in the deeply rooted obligation to be guardians of a great historical heritage and intellectual tradition. Let's give our kids those great benefits. And I'm going to take a second now to tell you that this is Sharon's husband. This is Cecily and Alyssa's dad. This is Mason's father. He's the oldest of my 4 children. I had him as a junior in medical school. And after I was asked to do this talk, we lost him in a mountain climbing accident. So this is dedicated to my son, a brilliant trauma surgeon, an amazing dad, a fabulous son, a wonderful leader and friend, and a great example of the kind of daddy that we want all of our family to have. I miss him deeply, and I'm grateful that I'm the mother of this great man. Thank you.